are you? Good. Well, what can I do for you today? I see. Do you have an appointment with us? Okay. And what's the name and date of birth? Okay, very good. I see you right there. So it looks like you are a new patient. So before we get you headed off to your appointment, I do have some questions to ask you if you don't mind. So some of these would be lifestyle questions, medical history questions, demographic questions, just a little rounded look at you as a patient. Now, in the past, we would give you a stack of papers to look at and sign and read, but we do find that people enjoy it a lot more if we ask them the questions and explain anything that perhaps is a little hard to understand or they're not sure. So if you would like, you're more than welcome to take our papers and go over them yourself, or we can do them right here. Okay, wonderful. So I do have a couple of forms for you to sign real quick, okay? So firstly, let me pull up my little sheet. Okay, good. So on the little screen in front of you, there's going to be a couple of spaces for your signature. Now, first thing we have is our HIPAA and privacy practices in this clinic. So I have a brochure right here for you. You're more than welcome to flip through it. If you want to either decline looking through it or look through it later, you're more than welcome to do that. Either way, this little space just says that I've informed you that we do have that material for you to read. So if you want to sign right there. Good. And the second one is our consent to treat form. So this just says that you are giving us consent to treat you as a patient. Okay. So if you'll just sign right there, then we can begin on our questions. Very good. Let me get that. Okay, excellent. So, just make yourself comfortable. There are quite a few questions, and we start with some demographics and some needs as well. So, firstly, what is your primary language? Okay, very good. Just want to get that out of the way. So we have your name and date of birth. Is there a preferred name you like to go by? And how do you like to be addressed? Very good. Okay. Do you have any special needs that we should be aware of or you need accommodations for? Things like mobility, communication, any vision help, reading, writing, listening, anything of that sort? Okay. And anything else that you could think of? Very good. Okay. So I'm going to ask you some lifestyle questions. If you do not wish to answer a question, you're more than welcome to. I would prefer that if there's a question you don't want to be honest about, that you would just not answer as opposed to not giving an honest answer. Some of these questions are for determining risk factors, or they also give us a little insight into perhaps some of your health concerns as well. Again, you do not have to answer any of these. It does help us out though, so just keep that in mind. So firstly, are you single or in any sort of intimate relationship? Okay, very good. And do you have any children at all? Okay. And is there anyone that you currently live with? Very good. Now, are you working full-time, part-time? Are you at home? Are you looking for a job, disabled, retired, or a student? Okay, very good. And do you have any food, medicine, or environmental allergies? Good. And do you take any medications, including vitamins or supplements? Okay. Right, and what is that dosage? Good. And how many times are we taking that a day? Good. And anything else? Okay, what's the dosage on that? And how often are we taking that? As needed? Okay. Very good. So, just a moment, scroll down. Okay, good. So I am going to ask you about different health conditions that you might have, okay? So let's see. Do you have any of the following? Anemia, anxiety, arthritis, asthma. Okay, have you ever had a blood transfusion? Cancer? A clotting disorder? Congestive heart failure? Depression? Diabetes? Emphysema, COPD? Okay, and what about gastroesophageal reflux disease, also known as GERD? Okay. What about glaucoma? What about a heart murmur? HIV or AIDS? High cholesterol? Hypertension? Kidney disease? Myocardial infarction? Okay, any nerve or muscle disease? Osteoporosis? What about seizures? Okay. And sickle cell anemia? What about substance abuse? Thyroid disease? Or tuberculosis? And any sort of surgical history. And this could even include something like your wisdom teeth, for example. Yep, like tonsillectomies, or if you had a particular bad broken bone, appendectomy, anything like that. Okay, and I'm going to ask you a little bit about your family history. Does anyone in your family, either side, have any issue with alcohol abuse? Okay, and breast cancer? Okay, what about ovarian cancer? And prostate cancer? Any other cancer? What about diabetes, type 1 or type 2? Okay, heart disease? High cholesterol? Hypertension? What about any mental illness? This could be things like anxiety, depression, ADHD, bipolar disorder, schizophrenia, anything along that line. Okay, and what about heart disease? Okay, and what about heart attacks? Right, and any stroke? Okay, and any other conditions on either side of the family? Any family history? Okay. Okay, very good. So that will be about all for our questions. Our doctors or nurses may have a few other questions just depending on the relevancy, but otherwise, let's grab a little map for you. Let's see. I think. All right. Just grab my pencil. Okay. So this is going to be our provider roadmap, basically. So depending on which provider you're seeing, this will tell you where you need to go. So if you go to the left, this is my left, so my left's this way, be your right. If you go to the left down this hall, at the end of the hall you can either go left or right. If you go left, we have our optometrist or we have our otolaryngologist. So that's where you could either get an eye or an ear exam. Now, if you are down that hall and you go to the right side, that is where we have our dermatologist or our nurse practitioner. So with the dermatologist, they conduct integumentary exams, whereas our nurse practitioner does our head-to-toe assessments. Now, if you choose to go to the right, at the end of the hall, you can go either left or right. If you go to the left down that hall, then that's where we have some different clinics for specific concerns. So we have the sleep clinic and we have the headache clinic down that hall. Now, if you go to the right side, that's where we have our neurologist and our general practitioner. So that's where you could get neurology exams like cranial nerve assessments. Or you could get the annual physical examination from our general practitioner. Okay? I know that's a lot of different things, which is why I have this map here. So again, if you go to the left side, that is where we have our eye exams, ear exams, our integumentary exams, or our head-to-toe assessments. If you go to our right side, that's where we have the sleep clinic, the headache clinic, the neurologist, and our general practitioner for annual physical exams. Now, at the end of each hall, there is going to be someone, and they can further direct you to where you need to go. All right? So there is going to be help along the way, and then you won't get lost. But I will give this little map to you. And all you have to do is you choose whether you go left or right. You can either go left or you can go right. It's up to you. Okay, so here's your map. And now you can move on to your appointment, either on the left side or on the right side. Go either to the left or to the right. Thank you so much for coming to our clinic. I hope you have a whale of a day and a good rest of your night. Thank you.